Newborns bring wonderful experiences to families and those around them. Watching a newborn child discover the world can be amazing. For all the wonderful experiences shared with a newborn, there can be times when you find yourself overwhelmed, tired, frustrated, or anxious with caregiving responsibilities. You may feel isolated or helpless, not knowing how to handle an infant or child's reaction to certain situations, especially when they cry. There may be times when the infant can be calmed by rocking or gentle movement, being held, sucking on a pacifier, being swaddled, or listening to music, white noise, or a caregiver singing. However, there may be times when the infant is inconsolable, and this can be frustrating for the caregiver. Sometimes a reaction to a child's crying is to shake the child until they become silent. But this shaking of an infant can cause permanent brain damage or even death. This is called abusive head trauma.
Taking care of a baby requires practice, patience, and understanding. Sometimes, despite all soothing measures, babies continue to cry. It is important to know that infant crying is normal and does not necessarily mean that anything is wrong with your baby or with you as a caregiver. In fact, there are some times of excessive fussiness called colic. If you notice your baby is crying at specific times during the night and day that last for several weeks, it is important to talk to your infant's healthcare provider for advice. Babies typically become more vocal around 2 weeks of age and have a peak time of crying of around 2 months of age. The crying may be unpredictable with no apparent reason. The infant may resist soothing techniques, which they may have liked before. The infant may have a facial appearance as if they are in pain. The crying may last from 30 minutes up to several hours and may tend to happen more often in the afternoon or evening hours. A baby can't tell us when something is wrong. The only way that infants can communicate with us is by crying. There are different forms of crying. They may be crying because they are hungry. They may be crying because they need their diaper changed. They may be crying because they don't feel well. You can do a quick check of the baby when the baby first starts crying.
If you find that none of these conditions are present and everything seems fine except for the crying, then that crying is normal crying. At this point, it's okay to put them in a safe place, such as their crib, playpen, or bassinet, without any pillows, blankets, or objects, for 5 to 10 minutes, and you may walk away and take a break in another room. In South Carolina, for licensed childcare facilities, cribs approved by the Consumer Product Safety Commission are the only acceptable sleep spaces for infants. You may want to think ahead of time of ways to de-stress, such as deep breathing or listening to music. Pick up the phone, call a friend or your healthcare provider, and talk to them so they can help you through that process. It's important for caregivers to take small breaks. If you're feeling anxious or irritable while responding to an infant that won't stop crying, you may not respond in the best way. It's during these moments that caregivers may become frustrated and shake the infant to calm them down.
Any shaking of a young infant is dangerous. The damage caused by shaking, or also known as abusive head trauma, can last a lifetime. The child may experience developmental delays, develop hearing loss, seizures, and blindness, also lifelong handicaps such as cerebral palsy, and severe intellectual and developmental disability. If a baby has been shaken or is showing signs of being shaken, it is important that they be taken to the hospital right away. Immediately tell the doctor that the baby has been shaken so that they can provide the proper medical attention as soon as possible. When you hold your child, always support the head and neck. Make sure anyone who cares for or holds your baby always supports the head and neck and understands that shaking of a young child, even during play, can be harmful.
Taking care of a newborn or infant can be exhausting and overwhelming at times. Crying is normal for an infant and how they communicate to others. If you have met their needs and they're not sick, you may try the soothing techniques we mentioned earlier. Once you know your infant's needs have been met and they're unable to be soothed, it's okay to place them in a safe sleep environment and take a short break. If you have concerns about your baby's crying, please contact a medical professional for advice. Remember, never shake your baby. Infant crying is normal, and it can be frustrating for you and other caregivers. If you are feeling overwhelmed, there are people who you can trust that are available to help you. Remember, You are not alone.